St. Lucie Medical Center is part of the Treasure Coast healthcare system that has been providing services for over 30 years. Their 229-bed hospital has grown with the community, ensuring access to the latest in technology and medical expertise. Services include emergency care, obstetrics, robotic surgery, and orthopedic and spine institute, behavioral health, and an extensive rehabilitation program. With over 250 physicians covering 41 specialties, St. Lucie Medical Center is here for you.
High-quality rehabilitation services for individuals recovering from an accident, illness, or surgery is a top priority at St. Lucie Medical Center. Our rehabilitation team of physical, occupational, and speech therapists are specially trained to help patients achieve mobility and daily living activities. Whether as an inpatient or through our newly renovated outpatient rehabilitation center, count on us for the best in rehabilitation services, lymphedema treatments, and advanced wound care therapies. For more information, call 1-800-449-8345. The Orthopedic and Spine Institute at St. Lucie Medical Center offers high-quality orthopedic care delivered in a unique environment that feels more like an upscale hotel than a hospital floor. Each of the 35 private rooms features state-of-the-art safety and monitoring systems and orthopedic equipment. Expert orthopedic physicians perform a full range of spine and orthopedic surgeries that help patients regain independence and get back to a healthy and active lifestyle. For more information, call us at 1-800-449-8345.
St. Lucie Medical Center is part of the Treasure Coast healthcare system that has been providing services for over 30 years. Their 229-bed hospital has grown with the community, ensuring access to the latest in technology and medical expertise. Services include emergency care, obstetrics, robotic surgery, and orthopedic and spine institute, behavioral health, and an extensive rehabilitation program. With over 250 physicians covering 41 specialties, St. Lucie Medical Center is here for you.
And as you've been hearing, St. Lucie Medical Center brings you Treasure Coast Health Week on with you every week, and we're happy to have two guests today. Jyric Sims, Chief Operating Officer, is with us. Assistant Vice President for Nursing, Jim Kruger. Jim knows the drill. He's been here before. It's good to be in his company again, too, and appreciate both of you stopping by here on the program, too. Now, we talked about the expansion of the emergency room. Freestanding ER now is coming to Darwin Square, the western part of Port St. Lucie, so St. Lucie Medical Center getting even further into the community right now. But just wanted to throw out, toss up, basically the uniqueness of St. Lucie Medical Center. What makes it stand out?
Well, outside of our good services that we provide certainly to the community, I think what you'll find when you come in is the great culture of the family environment. We round our leaders, directors and above. We round on every patient every day now, and then we all huddle from 9:30 to 10 every day to make sure we address the unique needs or any challenges that are faced by any one of our patients. Certainly, we're known for our Orthopedic and Spine Institute, which is 35 private rooms that really get you, it kind of feels like more your home away from home to a certain degree. Now,
what it looks like the hotel?
Yes, okay, it kind of looks like a hotel. And
I've been there. It is, it is. So.
Oh, very nice, very nice.
Not in it, but there. I'm visiting.
Understood. We always say we certainly hope you never need us, but in the event you do.
Like what you see. Yeah.
Absolutely. And I'm often asked, which orthopedic surgeon do I recommend? And in all candor and in all sincerity, you really can't go wrong with any one of them. We really have a phenomenal group of orthopedic surgeons on our medical staff and who choose to bring their patients to for services at our hospital. So anything else unique you can think of, Jim?
Again, I would just echo that it's a great unit, the ortho and spine. I've had 2 knees replaced there and had wonderful treatment, wonderful care. And the thing that I'm most proud of is that we have a 0 infection rate. And right. I think that that's something that I was going to be taking orthopedic surgery somewhere, I'd want to know that I'm going to come out of it without an infection. So very proud of that one thing.
That's an issue that you bring up here, because I know news media take it or leave it. You hear more about medical challenges happening within the hospital environment too, and I know that's something you all take very seriously. But it's really a challenge, though, isn't it? Making sure everything is spot spotless and bacteria-free and everything else. Yeah,
it really is.
It really is. That's why we have redundant processes in place. We don't just rely on the automated checks. We don't rely on the personal checks. We have 2 or 3 different levels of safety, if you will, to make sure that each patient is getting exactly what that patient wants and needs, and also just to make sure that we have those double check, triple checks in place. I mean, I don't know, Jim, you probably want to talk about in 2013 our aim for zero and kind of where we ended in 2013.
Yeah, in 2013 we did a campaign on fighting infection. We were actually recognized by the Centers for Medicare as a zero infection rate in our hospital. So it was quite a recognition to have the Medicare come and present us with an award for that. We started out with no what they call ventilator-associated pneumonias in the ICU, no skin infections, no what they call CODI infections, which are urinary tract infections. We kept them all to zero for a rolling 12 months. So it was pretty outstanding to get that award
and
this year.
And if you put that in context, last year we had over 47,000 ED visits, over 13,000 admissions, 3,500 surgeries. To be zero, that is a lot of highly skilled people really paying attention to what they're doing every day, and that's what we strive and what we preach.
Well, it's got to be one of the challenges, though, is who's coming into the hospital. Now, we'll get into the security, actually, but, I mean, people are visiting those in the hospital. Do we really know, essentially how healthy they are? It's not like they're bringing a dirge in or anything like that, but common colds or things like that, they may not be feeling their best. I know I've seen at the hospital, too, you're never more than about 20 feet from a hand sanitizer, all of these different steps that you've taken to do that, but it really is a challenge.
It is, and if we identify somebody comes in that is on a surgical floor, for example, and we find they're coughing, we'll offer them a mask to provide a mask so they won't spread any kind of an airborne vector. Washing their hands is the best thing they can do coming and going. We try to keep the children down to a minimal roar. You can't tell them not to come, but we just ask the families to use some discretion when they bring their children, especially the small ones. But plenty of hand sanitizer everywhere. We push it, and we don't have any stock in it. We just push it. And the stock is to keep people from getting infected. But a lot of training with it. We have security that's posted at the front of the hospital to help us photo ID people as they come in. And then through the emergency room, we do what we call a care partner program. And that is if you're being admitted, your loved one gets a little blue armband with the name of the room you're going to, and they can bypass security the entire stay that you're in the hospital to make it easier for them to come and go. But the band lets us know that we do know them and that we've established a relationship with them, and they're basically free to roam the hospital up to the rooms.
Another aspect of security code that obviously you're well aware of, but not only just at the front door, but, neonatal, new babies coming into the world, too. And I know security has really been beefed up in that area because of the strange things that go on with people coming in and stealing babies.
Right. We practice that all the time. We call it Code Pink, and we have a great deterrent up there. Don't want to go into a lot of it, but there's some real high-tech steps that we've taken to disarm the elevators, to disarm doors once somebody passes a certain key point with a child. So we have some...
it's your version of lockdown.
Version of lockdown, and Jyric can explain it better, but that's pretty much it.
Absolutely, yeah, and I'll tell you, it is so safe and secure there. I'm actually having my son there in early October, so
congratulations.
Absolutely, but to Jim's point, we drill it some more. That is one of those events that should never happen in the hospital, and that's when a baby gets off the floor and out of the premises. So once we call the code, we man all the exits. We make sure we know who's coming and going, and when we actually drill it, we drill it with live actors, and we actually have a baby that obviously it's a baby doll, but certainly we make sure that our staff can recognize anything that's kind of under the overgarments of individuals who are walking in and out. So we just continue to drill it and make sure we have the technological piece till we disarm everything to the floor to where everyone stays there. Yeah,
okay. So that, again, we're living in a time right now where these things we need to pay attention to. Unfortunately. When it comes to hospital security, and so we really appreciate the update on that, too. Now, as far as I know we were talking off air, Jim, but we seem to be parroting for time and time again nursing shortage, and and you're telling me now it's stabilized to a point.
It has stabilized to a point. We have what we call the STAR RN program, and what we do there is we identify the top graduates at the RSC level, and then we hire them, and they go into a STAR RN program. That means we send them down south to JFK, sister hospitals, to get special training for an 8 to 9 week period. They're on the payroll through a company called Parallon. Once they finish that STAR RN training, they get their ACLS, their TNCC, various certifications. Then they come back to our hospital to the units that they're predestined to go to. Matter of fact, we have 2 starting today, one in ICU, one in PCU. And so they come to us a little more prepared than a graduate nurse. The key is that they can never have worked in a hospital before, so that they will bring us no bad habits, essentially. And so it's been very successful. This is our 3rd go-around. And the nurses that we've received from the STAR RN program, we've not had to terminate any of them. They all seem to function very well. So it's a good way to kind of grow your own.
Yeah, well, we certainly are thankful for the nursing corps, too. And I know, like you say, it's different in a hospital setting, a medical center, because you're working 24/7. And I know that probably a lot of people go into nursing, but if they'll go into outpatient services and things like that, those are banker's hours, pardon for the lack of a better term, but it's a lot easier to deal with. So. But you have somebody then there that's willing to work. I think the scheduling, probably everyone I've talked to in nursing seems to like that, 410s or 312s, and so they get most of the week off. So
a lot of my nurses will do 312s one week, 312s the next week, and they get 7 days off in between there, and it works for their life with their children, and works for us at the hospital because we have tough weekends that are covered 100% of the time. So. Yeah, you get creative with the staffing. It works for everybody.
Yeah. Well, you mentioned IRSC, of course. Now, does it work better in an area when you are dealing with a nursing school per se than other areas that may have to work a little harder to draw nurses? But you got right across the way here, and they come right out of IRSC, go through your program, and then land at St. Lucie Medical Center.
I think that we're lucky to have that relationship. Yes, I think that we can draw a little easier from the ones that are here in the Treasure Coast area. Of course, we have some competitors that want those nurses as well, but sure. I think that the experience that they have at our hospital, like Jyric alluded to earlier, the culture of caring really sets us apart from the other facilities. We're well known for that culture, and matter of fact, if I could just say, last night I was eating dinner at the Olive Garden, and there was a couple talking behind me, and she was pregnant, and the wife, the lady that was serving said, "Oh, where are you going to go have your baby?" And the lady said, "Well, I'm going to go to St. Lucie Medical Center because they have the experience." And I, of course, had to turn around and I thank them for letting me overhear their conversation. But,
did you pay for their dinner? No.
I should have, but
no. Business expense, right?
Yeah. But a very nice couple, and they were very excited about coming in August to have their baby, and so it made me very proud to hear that out in the community.
All right, good. All right, Jim Kruger and Jyric Sims with us today on the Treasure Coast Health Week program. We're going to take our final time out here from the medical center that sponsors this program. We thank them for that. We'll be back with more. Stay with us.
Lucie Medical Center is part of the Treasure Coast healthcare system that has been providing services for over 30 years. Their 229-bed hospital has grown with the community, ensuring access to the latest in technology and medical expertise. Services include emergency care, obstetrics, robotic surgery, and orthopedic and spine institute, behavioral health, and an extensive rehabilitation program. With over 250 physicians covering 41 specialties, St. Lucie Medical Center is here for you.
High-quality rehabilitation services for individuals recovering from an accident, illness, or surgery is a top priority at St. Lucie Medical Center. Our rehabilitation team of physical, occupational, and speech therapists are specially trained to help patients achieve mobility mobility and daily living activities. Whether as an inpatient or through our newly renovated outpatient rehabilitation center, count on us for the best in rehabilitation services, lymphedema treatments, and advanced wound care therapies. For more information, call 1-800-449-8345. The Orthopedic and Spine Institute at St. Lucie Medical Center offers high-quality orthopedic care delivered in a unique environment that feels more like an upscale hotel than a hospital floor. Each of the 35 private rooms features state-of-the-art safety and monitoring systems and orthopedic equipment. Expert orthopedic physicians perform a full range of spine and orthopedic surgeries that help patients regain independence and get back to a healthy and active lifestyle. For more information, call us at 1-800-449-8345.
St. Lucie Medical Center is part of the Treasure Coast healthcare system that has been providing services for over 30 years. Their 229-bed hospital has grown with the community, ensuring access to the latest in technology and medical expertise. Services include emergency care, obstetrics, robotic surgery, an orthopedic and spine institute, behavioral health, and an extensive rehabilitation program. With over 250 physicians covering 41 specialties, St. Lucie Medical Center is here for you.
Welcome back to Treasure Coast Health Week. Now, in the final portion of the show, brought to you by St. Lucie Medical Center, enjoying our time very much with Jyric Sims, who's Chief Operating Officer, Jim Kruger, and he's the Assistant Vice President for Nursing, spending time keeping all the things that are happening at St. Lucie Medical Center. Of course, it's a fast hour, you know that, and you're on the road heading back here after seeming like just a short time. So anyway, but gentlemen, we thank you very much for being with us too. Now, we were mentioning IRSC now, of course, certainly turning out a fine core of people in the nursing profession as well. But in connection with that, you have additional duties there, I believe, Professor Sim.
I do. Kind of what Jim was alluding to earlier about kind of training and working with the nursing school to train the next generation of nurses. What I would definitely like to do is train the next generation of hospital and healthcare administrators. Mm-hmm. So I'm a newly appointed adjunct professor at IRSC. So I'll be, I've gave several lectures in the past there, but I'll be actually teaching a full course this fall as well. So working with Dr. Dandy and Jane Siebelak and the team there. So looking forward to it. So yeah, start this fall, and I think it's really one things that you have to do in healthcare administration. You have to continue to reach back and train the next generation. So I'm looking forward to it.
Okay, yeah, sounds good. Now, what's the type of student? I guess is there going to be more of an administrative?
Absolutely. At this point in their career, they're probably still trying to decide if they've chosen healthcare, what area of healthcare they're going into, whether it's hospitals, health plan, long-term, whether it's VA, not-for-profit. I mean, there's so many different facets of the industry. So I just try to help distill all of that into something quantifiable that they can then make a good decision off of.
Yeah. So. Out of left field here, is the issues with the VA, has it had any impact on the hospitals as a rule, or is this strictly an in-house thing right now? Because I know the talk was they may open up for veterans to go elsewhere. I mean, properly identified. I don't know. Is there anything moving on that, or anything that you know of?
Not heavy duty wise. We do get veterans into the ED, and we work very diligently to get them transferred to a VA hospital if they so require. We have the case management staff that help us deal with that, and sometimes the patients prefer to stay at St. Lucie as long as their insurance will cover it. Yeah. And we're glad to help them any way we can.
Yeah. Well, we know that the private sector, nonprofit, profit, whatever, we'll see how that the outfall of that too, as they try and sort out what's going on with the challenges going on with the VA right now as well too. So, you were mentioning also, Jim, of a Stay Frozen.
Yeah, that's correct.
Program coming up here.
Yeah, stay frozen and stay cool. The summer's here. Join us for the Frozen event and get tips to staying healthy and safe for the rest of the summer. It's July 26th from 9 to noon. We're actually having snow brought in. We'll have some snow for the young ones to play on, and we'll have some snow for the rowdy ones to play on. So we'll divide it up.
Just another way we're connecting with the community.
We want to do something fun. And it's apparently the Disney film Frozen is taken out. So we'll have some of the characters from the show there, and we'll have some free treats and some tours of hospital face painting and that sort of thing. So again, that's from 9 until noon. Or until, I guess, all the snow melts.
You better be bringing in a lot of snow then, especially. What was the date on that again?
It is the 26th of July.
So plenty of snow coming in as well, too. So and that'll be over at the hospital. So, all right, well, good. Gentlemen, thank you very much on that. Let's, we have a little time left here, too. But, gentlemen, let me start with you. What's the future of nursing? Where is it now? What have you seen over the time you've been in nursing, and what do you see on the horizon?
Well, I see a lot of things have changed. We were really struggling to get nurses to come into nursing. We've sort of made that hurdle with a newer generation coming in, and then us baby boomers, we're all getting ready to kind of hang it up. So we need more nurses to come in to take care of all of us. So there's a big push on nursing right now. Also, the mid-level nursing, the nurse practitioner, and the mid-level provider, the PA, we're seeing and needing more of those because
this is the step between nursing and doctors, right?
Correct, and there's a big need for that because the medical challenge is out there now with the changes in healthcare, the Obamacare. It's going to affect physicians' offices and hospitals to have more mid-level providers to carry out the duties that are going to befall us. But nursing, we're in pretty good shape with this latest, the Generation Xers. They're coming up pretty strong. A lot of it is value-driven. When I became a nurse, it was more what they considered a calling to become a nurse, and now it's young people are looking at it as a profession, an occupation, and I see the face of it changing a little bit, but as long as they continue to have that culture of caring taught to them, where they see the difference between essentially making a buck and taking care of somebody, they'll grow fine into nursing. But young administrators that are coming up to take care of us and help us nurture the way, it's kind of a balancing act between the administrators and the new nurses.
Male and female.
Male and female.
A lot more guys getting into this, right?
They sure are. And that helps considerably, especially in the orthopedic field. We need strong backs, strong legs, strong arms to help lift those patients. So nursing is alive and well in those specialty areas, ER, ICU, and orthopedics.
Yeah. How long does it take someone to become? I know there are varying degrees of nursing, but how long does it take to become a nurse?
Well, there's a 2-year program for associates, a 4-year for bachelors, another 2 years for a master's prepared nurse, and then if you want to go on to the ARNP, it's another 2 years on top of that.
So that's an 8-year program.
Basically, yeah.
Okay.
And there's a lot of opportunity out there.
It would seem so, too, now. All right, Jyric, now from your standpoint as Chief Operating Officer on it, where has it been, where is it now, and where is it going to be?
Well, obviously, I think where we've been is sort of a fragmented system in which certainly you go in any community, you can see 3, 4, 5, 6, some communities competing hospitals out there. I think under the Affordable Care Act, kind of where we're going, we're seeing quite a bit of consolidation going on. We see quite a bit of larger hospital systems acquiring the community hospital that was there but probably wasn't necessarily running what we call that a profit, if you will, and providing the services that are needed. So I think we're going to much more of a consolidated model. I think the Affordable Care Act certainly is getting more folks health care insurance, which who would argue with that? I think it's a phenomenal common good to do. So that's kind of where we're going, more of a consolidated model. But as Jim mentioned, with the baby boom generation getting ready to go into the age where they're going to start utilizing more services, as well as more folks having health care insurance, I think the field is great, is vibrant, and certainly I would encourage anyone who's looking to take a mixture of the business side along with the common good of healthcare and put them together. hospital and healthcare administration is a great field to choose.
Now, I know you've just completed expansion, of course, the emergency room. You're going to come to Darwin Scares. Anything in the future? Because we're a growing community and continue to do so. Or are you just taking a breath right now before you go to the next step?
Certainly kind of taking a breath. Over the next year, we're going to be constructing the freestanding emergency room at Darwin Square, and certainly we continue to look out west as well as in our backyard to look at where can we grow to continue to meet people where they are, and that's our overall goal. Certainly, we're part of the Treasure Coast Healthcare System along with Lawnwood Regional Medical Center, as well as Rolliston and Okeechobee. So as a system, we continue to grow to make sure there shouldn't be any type of illness or ailment that you need care or provided to you that's somewhere in the system that we can't meet your need.
Yeah, for sure, too. So, all right, staying busy and helping people every step of the way is what they're doing at St. Lucie Medical Center, too. And typically, it's a fast hour here on the program, and this is no exception, too. And time has gone by. We certainly have enjoyed our visit, too. And nice to meet you, Jyric Sims.
My pleasure.
Chief Operating Officer, and certainly would hope we'll cross paths again sometime, too. And Jim Kruger, we'll see you somewhere down the road, I'm sure.
You better believe it.
And enjoyed our visit with you, Assistant Vice President for Nursing as well. Lots going on at St. Lucie Medical Center, and lots will be going on. So, keep in touch with us, and we'll keep in touch with you on Treasure Coast Health Week, brought to you weekly by St. Lucie Medical Center. We thank them again for all that they provide for us in keeping this program on the air. Well, that'll do it for this hour, this edition of Treasure Coast Health Week. You've got world and national news coming up on CBS, and it all happens here. It happens now on WPSL Port St. Lucie at 11 o'clock.